Hello everyone. Let's move on to look into some details about learning objectives and the value of incorporating Bloom's taxonomy and the Miller's pyramid. Now, these terms like aims, objectives, and outcomes appear to be used interchangeably, as was mentioned earlier. Aims relate to the overall general statement of what the lesson will achieve. Objectives, on the other hand, relates to what students should have done by the end of the lesson. And outcomes are actually what students should be able to do at the end of the lesson. Outcomes should actually follow this acronym, SMART. SMART relates to specific, what the student should be able to do and how they will do it and to what level. Measurable, that is, you should be able to work out how the attainment will be assessed. Attainable, by the students taking part in the lesson. Realistic, that is appropriateness of the task, that is similar to attainable. And time appropriate, that is achievable within the assigned time or the session. Applying the three domains to outcomes, when we relate to knowledge, terms like to list, to explain, to describe, and to compare or to illustrate should appear. In relation to skills, we use terms like to demonstrate, to perform, to develop. And in attitudes, we can use terms like to reflect, to empathize, to initiate. Now, an example quoted here is to perform a venipuncture. The knowledge the student is expected to have are the veins that are present in the antecubital fossa, the indication for the procedure, and the correct instruments that are to be used for this procedure. Skills, the student is expected to know the correct veins in the antecubital fossa, how to puncture them with the appropriate sized needle, to draw blood, and then to be able to take this blood and put into a container and label them. Attitudes relates to explaining the procedure, professional behavior, and taking consent for the procedure. Now it's good to look at some of the terms that should be used when we write learning objectives. Verbs used when defining outcomes need to be specific and measurable. If you look at these two columns, on the left you find words open to many interpretations. So we should avoid words like to know, to understand, to really understand, to appreciate, to grasp the significance of, to enjoy, to believe, or to have faith in. It is better to narrow the meaning to words that have fewer interpretations like to write, to recite, to identify, to sort, to solve, to construct, to build, and to compare. Again, we refer back to Bloom's cognitive development when we write the objectives. The objectives are related to cognitive development. We write learning objectives based on the desired level that is appropriate for the student's learning. If you look at the figure here, learning objectives for the undergraduate may be at a lower level of the Bloom's cognitive development in relation to knowledge and comprehension. With increasing complexity as the learner moves on up the ladder and when he becomes a senior medical student or a trainee, then the learning objectives may be focusing on application and analysis phase. And then when he acquires more knowledge and is able to finally sympathize and evaluate, then the learning objectives will focus on higher order thinking. In that way, we are actually appropriately writing learning objectives in relation to being a novice or intermediate or the expert. The Miller's pyramid is often referred to in professional practice, especially in medicine. Miller's pyramid forms a beautiful model for writing learning objectives for clinical competency. If you look at the pyramid, the lowest level is knows. In other words, that's about knowledge. But what is more important as he moves up the learning ladder will be to develop competence. Then we have to work on learning objectives that shows knows how. And this shift then will move on to being able to do those procedures that he has learned. And so we move to performance or shows how, and eventually he does it, that's the action, and probably will reflect on the learning outcome. So the shift demonstrated in applying knowledge to skills will then move according to the level the learner is learning. Incorporation of professional attitudinal perspectives will become more important, especially when the procedure is more complex, and practice is seen to integrate all aspects of the three domains. That is, not only about mastery and internalization of the procedure, but also in terms of professional behavior and attitude. The value of Bloom's and Miller's is often easy to look at when we look at this particular picture where a doctor has got certain amount of knowledge and skills in examining a patient and problem solving and also deciding as to how the patient should be managed. Bloom's and Miller's will assist in aligning learning outcomes with what is expected of the learner at any stage of professional development. Initially, learners relate knowledge at a basic level, as in simulation, observation, and assisting. Later, with more experience and knowledge and skills, they will move from novice to intermediate and eventually move to the higher level of expertise, that is the registrar or the consultant. Again, we reflect on the three domains of knowledge, skills, and attitudes and relook at the learning objectives in relation to these specific elements. This is the verb wheel based on the Bloom's taxonomy, where we are trying to put into perspective how we should be actually using certain terms as is reflected in this particular wheel so that the appropriate verbs aligned to the student's products are shown. So here we have in the inner wheel all the elements that we have talked about in the Bloom's taxonomy, and we can actually use similar terms to be able to apply learning objectives. At this stage, it is good to reflect on what the learning outcomes are going to be in relation to how the curriculum is designed and delivered. If you look at this picture, the lesson outcomes are actually at the class level. The course outcomes are what the module will be designed in. The phase outcomes relates to the year of study or the semester of study of the student, and the generation of exit outcomes is eventually what we are looking for in the learning outcomes of the professional as he is ready for the practice. Knowledge cognition objectives have got two components that need to be reflected on. What are the teaching and learning activities for knowledge objectives, and assessment that is focused on the knowledge that is acquired. For knowledge objectives, most of the time the methods of teaching are lecture, seminar, tutorial, problem-based learning, case or clinical case-based learning, or even work-based learning. The assessment will then be focused on what has been taught, and then appropriate assessment tools, both formative and summative, are then incorporated. So if we are looking at convulsions in children, we probably want to know about the central nervous system and then the causes of convulsions in children apart from the febrile convulsions which is commonly seen in children. In regards to psychomotor domain, that is the skills domain, learning objectives are written in terms of competency. And these 5 elements need to be reflected on, that is imitation, manipulation, precision, articulation, and naturalization. In imitation, if you look at Miller's pyramid, we are really looking at observation as one does, and then he reproduces skills after observing that particular activity. Manipulation refers to the demonstration of the skill from instruction, that means he shows how. Precision, it is so important in order to ensure that not only are the procedures done, but it is also important to exhibit the knowledge that is derived from such a procedure. If you look at this example, if we are talking in terms of examining the abdomen, it is not enough for the student to know all the steps of abdominal examination that is done systematically, but he should be able to elicit the correct pathological findings after the palpation of the abdomen. Of course, articulation and naturalization will follow with appropriate training that the student acquires, where he will harmoniously execute a combination of skills in sequence and then eventually become very skillful such that it becomes literally an automated procedure. Now, attitudinal objectives are much more complicated, and this is relating to the pattern of observable behavior. In a complex situation, as is shown in this picture in a very busy medical ward, you can see that not only are the students or the lecturers or the postgraduate student being able to do the services of being a doctor, but there are other elements like behavior, culture, and the value system that need to be incorporated into the learning process. So learning objectives need to address all these issues through these various elements that has been pointed out here: receiving, responding, valuing, organizing, and characterization. As one can see, it actually follows how the student is going to observe, eventually respond to all those that is important in the way he is going to learn in an authentic situation, and values the various behavioral approaches and professional behavior required of him in a complex situation like that, so that he can show these values as to how he will approach a sick patient, how he will talk to a senior person, how there will be an operation of interprofessional care. And this is all reflected in eventually the characterization phase of attitudinal approaches to clinical learning. So for each lesson, define the aims and learning outcomes. A quick list is put up in this slide. Consider the structure of the session and the timing of activities. Decide the most appropriate teaching and learning methods to achieve the learning outcomes. List the contents and the key topics that are supposed to be appropriately mentioned. Refine the lesson plan. Identify all the resources that is needed, including clinical materials and equipment. Finalize any linked assessment or evaluation, because evaluation and assessment is going to determine the appropriate outcome, and that is what the learning outcome should reflect. Some take-home message on learning objectives as reflected by Robert Mager, who said, what the learning objective should be is what the learner will be able to perform as a result of some learning experience. Three important elements that have been highlighted are performance, condition, and criterion. Performance relates to the objective, which must be specific. What learners must be able to do or perform when they demonstrate mastery of an objective. The condition describes the relevant conditions under which the learner will learn. Is it a simulated lab? Is it a real patient he is going to deal with? Or is he going to be working in an operating theater? Criteria specifies how well the learner must perform the action. This is actually the most important part in relation to the outcome as to assessing competency. Thank you.